Hello, my name is Michelle Welch, and my final paper presentation was on patient education and patient outcomes. Of all the factors which can have an impact on individuals' health and lack of health education is one of the biggest. From young, the way a person eats, their level of physical activity, and how much they go to the doctor can determine how healthy that person will turn out to be. And for me, I challenged that a lot and decided to take my healthcare very serious and did a transition with turning around with working out, eating right. I lost 30 pounds. I was once like at 190 pounds, my biggest ever. Wasn't happy, so I decided to change it. There are times when healthcare providers can feel at odds with their patients because the patients are resisting to their advice and treatment options. More times than not, this is because patients does not have the necessary information to understand why they need to follow the doctor's orders. True. By working with patients to instill better understanding and how their lifestyle choice affect their health, there is a greater chance of facilitating healthier choice. Example, promote patient education and wellness, create better overall health outcomes, can really help. Healthy literacy is so important because it impacts on how individual makes decisions that affect their health. So many people do not properly take their medication, true, or modify their life to doctor advice as they should because they do not understand why they need to. Some people, when it comes to taking medicine, feel that it'll make them overweight, causes them to eat more or stop certain things that they can do, make them more slippy. But unfortunately, some medicines does have side effects, but if you inform your doctor, maybe they can switch the medicine versus you just not taking any at all, which can really help long term where your health will be very important and you can live and do everyday activities and go to work and do the things that you like to do. There's a lot of misinformation out there as well. The internet has given so many people so many access to a wide range of information. While this should be a good thing, it can also create problems. When people are not able to discern between true and false information, a lot of people do go off what the internet says and not take a doctor's order, which is not good at all. You should always follow your doctor's order. With so many so-called health and wellness experts giving people inaccurate information, healthcare providers can find themselves having to compete to ensure people are not following the wrong advice. It's very important that the actual experts are communicating with their patients so that they are able to make the decision that will lead to greater health and a better quality of life. Public health and programs. In most major public health events that people can remember, there are attempts to get out the information to prevent further spread and help people cope. In the last 4 years, with the onset of the COVID-19 virus, there have been many attempts to get people the information necessary to stop the spread and help to deal with the virus once they have it. When COVID-19 hit the world tremendously, that people in the beginning wasn't taking it serious, and we lost so many people when all you had to do was just wear your mask, wash your hands. It was helping and presenting to save a lot of lives. And if you had COVID, just stay in quarantine. Some people didn't want to do that as well. So we faced a lot of challenges with COVID-19. And unfortunately, many scientists and doctors have been overshadowed by people who have used their platform to spread harmful rhetoric that has led too many people not only concentrating the virus but succumbing to it. This is why it is so important for doctors to do what they can to make connections with their patients and inspire the confidence that will encourage their cooperation in their own care. A lot of people didn't want to get the COVID-19 shot, which is save lives. It helped. All you have to do was read up on it. It's several different ones out there that people can make a choice, and a lot of people have turned around and started listening, and that's why we able to, I feel like, go out and the world is kind of opening back up with you can do more things, which is what we need. Doctors' patient partnership, as stated in the article, improving health outcomes through patients, education and partnership with patients. When physicians and patients take medical informed consent seriously, the patient-physician relationship becomes a true partnership with shared decisions, making authority and responsibility for outcomes. Healthcare providers can hardly hope to keep their patients healthy without the participation of the patient. Without successful cooperation, any progress that the doctor makes in healing a patient will be consistently derailed by the patient's continuing unhealthy behaviors. By making the patients a part of their own care team, the doctor increases the likelihood of success for any care plan in which they enact. Patients' understanding. Many do not have very clear understanding on their role in their own health. They will make unhealthy decisions, and once it leads to a problem, they will run to the doctor to fix them. I agree. However, once they receive the doctor's opinion, many still will not utilize their care plan effectively. As stated in the approaches to patients' education, emphasizing the long-term value of compliance and persistence, approximately 50% of patients with chronic disease do not obtain optimal clinic benefits from treatment because of poor compliance with medication REMS. Lack of compliance is associated with poor clinical outcomes, increased hospitalization, lower quality of life, and higher overall healthcare costs. Lack of compliance causes a great burden on healthcare system to ensure better outcomes. People must be made to understand exactly why their prescribed care plan is being enacted. Understanding will lead to greater trust and less dependency on the doctor to constantly fix the problems being caused by the patient's ignorance. Offsetting parental influence. People get the vast majority of their health habits from their parents or guardians. Not only do parents pass the hereditary factors, but they also set the tone for their children's lifestyle choice through the diet and activity levels in which they instill in their children. I totally agree. I work out every day. My son plays basketball and he's workout as well. He's into the fit world just like me. My husband and stepson as well. We don't eat a lot of bad food. I do make sure that they understand, and I cook healthy so everyone can live a long life and not be just obsessed to bad food all the time. So I totally agree with this, that it does start within parents and families to instill that we should, teach our children that being healthy and eating healthy is something that you want to do for you so you can be here for a long time.